my distinct honor to welcome you to the opening of the University of Arizona Cancer Center at Dignity Health, St. Joseph's Hospital and Medical Center. I got it all in there. Big round of applause. Great day. As Mayor of Phoenix, this is a great moment for me personally, but more importantly for our city. Today is a major step forward in the vision that we together set forth over 16 years ago to transform our economy, to be more innovative, to be more globally competitive through investment in bioscience and medical education. And so I was proud to be part of the team that helped lead the effort for the city to provide the land and in-kind support to help start up not only this building, but the entire Phoenix Biomedical Campus. As a city, we didn't wait for others to lead. The city of Phoenix did and continues to step up to the plate to set the tone for moving our economy forward in the direction of bioscience, medical education, and research. This has been a team effort. Our city council, our universities, our state legislature, our federal representatives, the board of regents, our business community, the healthcare industry, the foundations, all of us have partnered together to make this happen. So many of you are here today, and I want to personally express my gratitude for making this a true regional and statewide partnership. I owe a huge debt of gratitude to my partners on the City Council. Councilwoman Kate Gallego is going to be speaking in a few moments, is a great leader in the biosciences, but this is unanimous support from our City Council. Our great state representatives, we wouldn't be here today if you didn't support our universities. Representative Ken Clark is here. State Senator Katie Hobbs couldn't be here, wanted to be here, but Leila Alston is here as well, and all members of the legislature that supported this effort. As mayor, I owe you a huge debt of gratitude. Dr. Kraft and the current leaders of this cancer center, thank you for what you have done and will do. And the one person that we owe more of a debt of gratitude than anyone else, he was there first. If we're a huge success, it's because we are standing on his shoulders. Please stand, Dr. David Alperts, because we wouldn't be here without you. You are the best. This cancer center is what happens when we work together. As you know, the city's a full partner. We committed $14 million to this project at a time that when we were still recovering, emerging from that incredibly brutal recession. We took that risk because this center is critical to our plan to be more competitive in today's innovation-based economy, while at the same time making a difference in the lives of people living all over the world. I predict that the people of Phoenix will say that this is the best $14 million that they ever spent. This magnificent 220,000 square foot building will deliver three very important things that we need in Phoenix. First, a higher quality of health care and cancer treatment for over 60,000 people every year. The work in this building will save lives. It will mean more lab space and enhanced learning opportunities for medical students. These tools will help University of Arizona lead the way on neuroscience and cancer research with an emphasis on healthcare outcomes. And for our local economy, this center has created hundreds of high-end, highly skilled jobs in the heart of our city. Our efforts to change the trajectory of our economy is taking a big step forward in the right direction today. Being involved in and invested in this cancer center has put me around the table with some of the incredible leaders who are responsible for what we are here today. I mentioned some of them earlier, but I got to mention these amazing leaders as well. Of course, Linda Hunt, CEO and President of Dignity Health Arizona. Thank you for being such a strong leader in this effort. Give us a round of applause. Our friend and partner, Patty White, will be speaking as well, CEO of St. Joseph's Medical Center. You're the full partner in this as well. And of course, my friend, we've developed a very close working relationship, and I can't wait to continue to work closely with Dr. Ann Weaver Hart, President of the University of Arizona. A great leader. It's a privilege to stand with you today. We all know that this was not always an easy process. And at one point, there was a serious impasse at this point. So I got to personally see Linda Hunt and Dr. Hart work together at that coffee shop at 12th Street in Glendale, where we kind of set the lawyers aside and these guys got together, and I saw leadership in action, where they were committed to get the yes, to reach an agreement and compromise for the good of their institutions, the good of this city, the good of our economy, and that's exactly what happened. We would not be here today without the courage and hard work of Linda, Patty, Ann, and so many others at Dignity Health, St. Joe's, U of A, and here at the City of Phoenix. So by opening these doors, we are helping to guarantee that leading physicians and researchers in the biomedical sciences will be drawn to the Valley or convinced to stay here, to raise their families here, and to call Phoenix home. And more than that, this facility will inspire students in Phoenix here to be the next generation of leaders in the fields of oncology. This is how we secure Phoenix as a national leader long-term in the biomedical advancement. So thank you again. I'm so proud of what you have all accomplished here today, and I'm excited about what our future holds. A great day for Phoenix. Thank you so very much.
Thank you so much. It is a privilege to follow Mayor Stanton, who is our real leader in making sure we have an innovation-based economy in Phoenix. We're taking the greatest city in the country, in the world, and making it even greater in partnership with Dignity, University of Arizona, and others. It is such a pleasure for me to represent the bioscience campus. This really is part of the reason I ran for office. I was working in economic development and wanting to make sure we have a diverse economic base with a lot of knowledge-based industries and jobs that can help people from all across the education spectrum. And this is what it is all about at the City of Phoenix. So I'm very glad that we are moving forward with this and want to thank our partners. Beyond the people here, it's really been a team effort. Our folks from Downtown Phoenix Inc., Downtown Phoenix Partnership, several City of Phoenix departments have been working on this, and so thank you to all of those on our team to work on the surrounding area. And I hope it will be a great surrounding area. We are thrilled that we will see 500,000 visitors per year. This will be a real economic engine, and the city will continue to work to make sure it's a great place for them to visit. So reminding everyone, just up 7th Street, several James Beard award-winning restaurants. Feel free to stay for lunch and enjoy our great downtown, enjoy our sports teams and their new commentator, Mayor Stanton. And we'll hope to continue building. We've had several successful partnerships, including a new one recently announced with the University of Arizona, and we'll continue having St. Joseph's as a great partner. I had the privilege of being treated there myself, and I'm so glad that more people will have that opportunity as we move forward. Fighting cancer is something, as Dave mentioned, really everyone has a story, and whether it's seeing President Carter in the news this week to someone in your own family, we've all been impacted, and this will be a great resource in making sure Phoenicians have the best opportunity to get the best care in our community. 60,000 patients annually, so it really will be something that will change the face of healthcare in this area, and we're thrilled about the jobs that will go along with it. $250 million impact. This is something that will help our city become so much stronger, a more diverse economy, weather those downturns in the future. And the campus has been so successful, we're looking at the city of expanding it into more of a corridor and going even further east, because we hear regularly from people, they want to be in this area, they want to be part of what the University of Arizona started and bring more resources to the area. So this is part of a major initiative we have in partnership with the Phoenix Chamber of Commerce, Phoenix Forward, and Linda Hunt and Dean Flynn, among others, have been our leaders in that area, trying to get the whole community together so that we have, from the education spectrum to the facilities, everyone going in the same direction. And University of Arizona was the catalyst for this. So many thanks to them for their wonderful leadership. We look forward to seeing how much of a great impact this has on our community. And thank you to all who were there and involved in making this great day happen.
It is really special for the mayor to talk about what it took for President Hart and I, really, and a number of other community leaders to make this happen. And thank you for being here. So while many of you are visiting this building, the University of Arizona Cancer Center at St. Joseph's Hospital for the first time today, I want you to know what an amazing project and part of an even greater vision over many years this has been. It's been a dream, and it's been a dream that sometimes was a little elusive, as you've heard, but we all held tightly to the vision of partnership. And today, I'm excited to say it's real. And we're here today, not only for us, for all the people we're going to treat. I know a lot of other speakers are going to tell you about all the great medicine and research and care that will go on inside the center. But I want to talk to you about why this partnership with the University of Arizona Cancer Center and why it's so important to all of us. In Dignity Health, we're really about changing. We're about looking at optimizing the care for people. We're on the vanguard of tremendous change in healthcare. So in order to really accomplish that, we have to think differently. We have to change our paradigm. But change is a part of who we are every day at Dignity. When I look at the sisters who are sitting right in front of me, not these two, but a number came here 120 years ago. I have to watch because some people think that's how old they are. They really came not to start St. Joseph's Hospital. They came to teach and educate, especially around music. But when they got here, they looked around this community and they said, wow, that education is important, but healthcare is even more important. That type of pragmatism is still at the heart of the sisters and our organization every day. Excuse me. In the past few years, Dignity Health Arizona has grown dramatically. St. Joseph's, though, remains our flagship and a very important part of this community. We have 6 other hospitals now in our system. But our growth has really happened through partnerships with incredible organizations, many who the CEOs are here today, just like our partnership with the University of Arizona around the Cancer Center. Dignity Health wants to join forces with the best of the best, and that is what we are doing here today. This amazing collaboration will allow us to spread our mission of healing throughout the community and to touch a greater number of patients and families. Dignity Health and the University of Arizona Cancer Center have many things in common, but the most important is our dedication to our patients and our families and doing it right. As we open these doors, Dignity Health wants every patient and their family to know that our business is medicine, but our passion is caring. The University of Arizona Cancer Center at St. Joseph's will be our extended family and a place where patients can be heard, who can be loved, and cared for in a very different environment. It's all about hello, human kindness. I also want to thank everybody who has worked so hard on this. Jeff O'Malley didn't get called out, but I can tell you Jeff was one of the original soldiers working on the contracts with the attorneys and has slugged through a lot of words, and I want to personally thank him for that. This is a remarkable moment, and I just want to personally say thank you for making this day so great. I am full of pride, but I'm even more excited about all the promises that this facility will bring. Thank you very much.
This is, you have no, you've heard from people already about how exciting this day is. It's really hard for us who worked with the incredibly smart and caring people who had a vision for this cancer center to see this reality and to know how many people and how much talent and what incredible brain power went into making this happen. This is a perfect example of my belief and your actualization of the principle that leadership is an institutional quality. There are so many people here who have made this possible, and it wouldn't have happened without each and every person. And so we don't cast aspersions on the attorneys, I'm going to follow Linda's example and give a shout out to Laura Todd Johnson and Art Lee, who is here. So, because you know what? It's okay. They actually read all those words. And we're all just as grateful as we can be that we didn't have to read them all, and that we could just look them in the eye and say, does this say what we think it says, and can we trust it? And it's a wonderful vision. We are so incredibly proud of this opportunity. I want to add something really critical for all of us to think about, and that is, you've heard a lot about translational medicine and how important it is to translate the incredible basic research that happens at wonderful places like the University of Arizona into changes in the way we live our lives and the things that we do. And while that seems natural, and when we hear phrases like science-based medicine, we think, well, of course medicine is science-based. Well, guess what? We do things based on habit, expectation, custom, and culture, and we often make decisions based on what was comfortable. I'm reminded of a story that I read years ago about how much impact practice and culture can have on our lives. A young woman who was learning how to cook and was on her own trying to do her first family dinner had bought a big roast and was cut the end off to put in the baking dish in the oven. And her husband said, "Why did you cut the end off the roast?" And she said, "Because my mother did. And so that's how we cook a roast." And he said, "Well, I don't get it. I don't know why you do it." And she said, "Well, I'll call Mom." So she called her mother, and her mother said, "Well, I don't know. That's the way my mother did it. So I always cook that way." So they all decided they better call Grandma and find out why the family cut the end off of a roast before they put it in the oven. And Grandma said, "Well, because I couldn't get it in my baking dish. My roasting pan was too small." Well, believe it or not, there are some things in medicine that we do in exactly that way. And so being able to do the kind of research that this incredible clinical care center makes possible, to be able to work with world-class cancer physicians and make sure that cutting-edge practice is available to the citizens of Arizona here in the Valley, that translates that knowledge into treatment and tests those treatments. So we actually do research comparing the effectiveness of treatments, that we actually do research that measures the impact of our treatments on the outcomes of our patients. And while I'm a firm believer in stories and the examples that each of our experiences provide for practice into the future, I also know that what we see in front of us isn't always what the practice of medicine for all of human beings really needs to know and do. And this place, with Dignity St. Joseph's, with the researchers at the University of Arizona Cancer Center, will make possible that improvement where we actually test our research on our outcomes, and those cutting-edge treatments are available to the citizens of Arizona. What better realization of the vision of the docs at the University of Arizona Cancer Center and the incredible physicians at Dignity Health could we ask for? And I just want to tell you that my pride in this accomplishment is unbounded. I want to also follow in the footsteps of the speakers you've already heard and thank many of those who have had a tremendous impact on making this possible. The $14.4 million, I counted, it's in the building, dollars that Phoenix put into this incredible facility really did make the difference in our being able to make this facility a reality. The incredible gift and leadership of the Del Webb Foundation, which has helped the University of Arizona in supporting this wonderful building, but also for Mandira Jalajakshi, and in her honor, the tremendous gift of Doctors Meera and Ramkrishna that is so instrumental. And I encourage you all to go and see this beautiful garden in her honor. How wonderful that she is represented here in the very best world class, cutting-edge treatment, and we want to thank them so much for their time. I also want to give a personal shout out to Linda Hunt and her leadership. Many of you may not know that Linda actually flies to San Francisco about once a week.
It feels that way.
Not quite. But in addition to that, so her leadership is on a national scale. And she is and has been so committed to the very best world-class clinical care through all of our conversations about the Cancer Center. And it is true that as we live longer, and we're very glad to be living longer, a truism is that more and more of us will experience the devastation of cancer. And we need to know how to treat this terrible disease. And the leadership of Dignity Health and the sisters who have been here in the Valley for so many years is tremendously important. And I want to thank all of you for doing that. On behalf of the University of Arizona, the Board of Regents, the incredible doctors of the University of Arizona Cancer Center, the incredible doctors who treat the Cancer Center patients here at Dignity Health St. Joseph's, all of you have made this vision a reality. It is indeed a testament to what we can do together that none of us could ever accomplish on our own. And I am filled with pride to be a part of the team that made this all possible. And welcome to the University of Arizona Cancer Center at Dignity Health St. Joseph's Hospital.
For 40 years, the University of Arizona Cancer Center has been an NCI-designated cancer center. They've been designated because they do cutting-edge research, because they bring novel treatments to patients. It has been the dream of many in this room, Dave Alberts, Peter Lance, Tom Brown, to bring this cutting-edge research to Phoenix. It's finally happened now with the collaboration with Dignity Health. They wandered for 40 plus years in the Sonoran Desert. Finally, they made it to Phoenix, and they're very glad finally we're opening the building. I've learned during my career not to fear cancer. Cancer is beatable and treatable. We've made major advances in cancer therapy. We've made leukemia into a chronic disease. We've treated and cured various sarcomas. 20% of melanoma is now curable. But we have major challenges, and these challenges have to do with advancing clinical research into patients. We have advanced vaccines, but we have the challenge of more vaccines. I think that the university can make this happen. We can be successful, and we really need all of your help to make this occur. This is a beautiful building, but our goal is not to have this building forever. It's to bring down the walls and to make our efforts successful. Thank you very much.
I have to say that I am tied to this land. And by the way, Linda Hunt, you are a rock star. Let there be no doubt about that. Okay. I went to high school on this campus. And when the University of Arizona Medical School became a resident on this campus, I was thrilled as a true blue wildcat. And I realized as we were talking, as I met you, Dr. Alberts, my connection with the U of A Cancer Center goes back even farther. As a young state senator, I was able to serve on the Appropriations Committee and vote on those funds that made the U of A Cancer Center in Tucson a reality and a growing and vital place for our community. But my journey with cancer started a little bit before last October. I had a wonderful resident where Dignity Health trains at Pepper Tree their family practice dogs. And I had been a patient of that clinic for decades. And I had a brand new dog, and I said to her, could you please order me a chest x-ray because I am a former smoker? And she said, you know, Leila, she said, I think we've got a study at the hospital because a low-dose CAT scan will tell us much sooner and better than a chest x-ray about whether or not you have cancer. And so one of the gifts was that Dr. Aronson, Jennifer Aronson, who is now graduated, and I don't know if she knows that she saved my life or not, I hope she does, but they got me into that program, and one of the greatest gifts initially was that I found out I didn't have cancer. All of us who have ever been longtime smokers always have that fear in the back of our mind that we've got lung cancer. But bingo, this last October, I had my annual low-dose CAT scan, and it fortunately was bumped out to the director of the study, Dr. Albert Quo. And Dr. Quo was with the Norton Lung Institute in Phoenix. He was my lung surgeon, and he had all the connections with the wonderful University of Arizona cancer docs. And he said to me the day he gave me the diagnosis in mid-December, he said, would you like to see your oncologist today? And I said, well, of course, let's get going on this. And he said, I said, where do I need to go? He said, well, upstairs. And he assigned my quarterback, Cindy Stotts, to go with me, literally, upstairs to Dr. Phidias's office. And she stayed with me until she was sure I had that appointment and was going in to see Dr. Phidias that day. You get to go through a lot of tests when you find out you have a cancer diagnosis. And we had some side trips along the way. They found a mass in my ovary. And so my daughter says, Mom, you got a bonus surgery. Because when they found that mass, they took me off the schedule for the lung surgery and said this takes priority. And so I have to thank another of our wonderful cancer center docs, Dr. Monk, who I went to see him on the opening day of session. And before I left his office, I was scheduled for surgery the following Tuesday. And then Dr. Phidias, Dr. Monk, and Dr. Quo were all in my hospital room the day following that surgery, and luckily for me, it was benign. And Dr. Quo said, I've had a cancellation for next Wednesday. Do you want it? Yes, sir. Let's go with it. And so I had 2 surgeries 8 days apart. But I'm like the bionic woman because I had all those special robots. And I had in-house doctors, also Dr. Eric Meyer and Dr. Randall. The trauma center doctor at U of A in Tucson. Freeze. Sorry, Dr. Freeze, I hope you're not here. And don't any of the rest of you tell him I temporarily forgot his name. But anyway, they took care of me at work as well as in the medical facility. And someone said to me, Leila, you got that special care because of who you are. And I said, well, no, I didn't. And, they said, well, yeah, you're the state rep. Of course you're going to get that kind of care. I said, no, I did not. I was most fortunate because when I was out for a procedure, after I'd had my first surgery, my son was waiting for me to come back in my hospital room, and Patty White came to my room and said to my son, how did your mother sneak into my hospital? and so My care has been exquisite. The path has been smooth. From day one with Dr. Quo, I knew it was going to be all right. No matter what it was going to be all right. And on Friday of this week, I get to do my PET scan. And next Tuesday, Dr. Phidias, the love of my life, and I have confessed that to his wife, is going to tell me, you're okay. And the following Monday, I'm going to meet with Dr. Brackman, who did the radiology, again with another bionic machine. And he's going to tell me I'm okay, because I had lung cancer in both lungs. And so I am here because of all of you. And I am going to live the fullest life possible, and I am dedicated to helping take the shame out of lung cancer and to help everyone I know. I've got a list that I've already started on. Everyone I know get early detection, because that's the reason that we can have the cure. And from the bottom of my heart, thank you so, so very much for giving me the opportunity to make some people's lives miserable, but to enjoy the rest of my life with my son, my daughter, and my 6 grandchildren, and whatever I can ever do to help others find you and you find them to have those cures. I'm here. I'll cancel all appointments and step right up. And I love you, Dr. Phidias. Thank you.
Well, Representative, now I'm mad at you for 2 reasons. You snuck into my hospital, and I have to follow you after that. Seriously, right? So I want to thank everyone for being here today. It's hard to add anything to the previous comments, so I'll just be very brief. But there's a couple of things that I do want to say. In March, we celebrated 120 years of service and caring in our community. I was there all along with the sisters, But during that time, we have had a lot of firsts. I've been able to enjoy a lot of firsts in our organization, but today is very much a huge milestone for us and a first in being able to collaborate to take care of patients with cancer in our community. So I, along with all of my other team members, are very proud of this day. And as well as many of you thought maybe we would never get here. So it's been a fantastic journey. So the new Cancer Center will open in a few days. Marcia, still August 24th. Yesterday we had a huge milestone. We were able to pass, I guess is what you would call it, our state survey. If you don't do that, you can't open the door. So it was a very huge day for all of the team here. And there's a lot of detail that goes into that to make sure that we're really ready to take care of our patients. So along with our colleagues at the U of A Cancer Center, and yes, I am a wildcat. I live in Tempe, so I have to kind of downplay that a little bit, but I went to school in Tucson as well. We'll join forces to make sure that we provide the premier care in our state. You've heard we spent a lot of time planning this endeavor. We've searched the world over. You've heard about some of our fantastic physicians. We're bringing medical expertise to this community. But I especially want to call out a few people. One is Marcia Gruber-Page. Please stand up, Marcia. Marcia has been the nuts and bolts and leader in bringing this center forward. She's our Vice President of Oncology Services at Dignity Health St. Joseph's. The building had to be so big because the name is so long, I think, right? I'm like, can we shorten this at all? But no. And I'd like to thank her husband, Sal, too, because he gave up a lot of time with her because she's worked endless hours. The other person that I'd like to call out, is Dr. Peter Lance. Peter, would you please stand up? Peter, you stuck with us through thick and thin. You came to Phoenix, you've served as our deputy director, providing the leadership, the physician leadership that we have needed and wanted. So from the bottom of our heart, thank you so much. We really appreciate it. I want to mention the whole team that brought everything together. We have what's called a transition and occupancy team that have about 1 million ticks that they have to tie together to get a center like this open. So thank you for all of that hard work. Finally, and Representative, I think this is for you, and any of our patients that come to this center. Your fight is our fight. And our promise is not only the best medicine, but an intangible compassion that you will find only at this center. It is something we call human kindness, and you will feel it when you walk through these doors. So, as I mentioned, this project has been many years in the making. And no one knows better than Sister Madonna the long history of wonderful cancer care at St. Joseph's. Sister started the first oncology life enrichment program at St. Joseph's in 1977. It was a novel idea. She brought together an integrated team that included physicians, nurses, social workers, and chaplains to acknowledge Sister Madonna's contribution to the care of cancer patients in our hospital and our community. We're going to name the center's meditation room in honor of the Sisters of Mercy. So here we go, Sisters of Mercy Meditation Room. So this will be
it's a real privilege and honor to be here. And for those of us in the front, we get to see this huge group of individuals who are both passionate and committed to the new Cancer Center. And I know that you're going to have a very important part to play in the wonderful work. And we thank the community members who were able to join us. So today, we ask God's blessing on all of this magnificent project that blends both medicine and healing into a beautiful collaborative project. May our work together bring healing and wholeness for patients seeking care here at the Cancer Center. And may our efforts focus on the dignity of the human person as we assist patients on this journey towards wholeness. We pray for our physicians and staff members. May they continue to collaborate together, discovering new ways to treat patients. And we want to think about increasing access to care for individuals in our community. And we pray that the poor may have a new access to care for healing of cancer. And we thank God for this opportunity to assist in the care of the human person. Amen. Yes.
I would just like to say, as a cancer survivor, there's no one greater than I for thanking for this facility. Thank you.
3, 2, 1, cut.